Quick facts, page 6. We have signs of a ruptured aneurysm. Severe pain, nausea, vomiting, tachycardia, decreased LOC, hypotension. You want to avoid straining, lifting, or exerting. Take meds on schedule. Report severe back flank pain. Anorexia nervosa. The primary purpose of this is starvation. The perception of their body is distorted. Age of disease usually occurs in adolescence. Usual personality type of anorexia nervosa is being a perfectionist, overachiever, or low self-esteem. Major cardiac complication of anorexia is arrhythmias. Gynecological complication, amenorrhea. Treatment and recovery, small frequent meals with inpatient counseling and milieu therapy. Moving on to appendicitis, bottom of page 6. Commonly seen in 10 to 30 years of age. Acute right lower abdominal pain. Signs and symptoms include loss of appetite, nausea, vomiting, and a low-grade temperature. Localized tenderness is found at McBurney's point. What are the tests to determine appendicitis? Complete history and physical exam with WBC count, which will be elevated, indicating the infection. Treatment for appendicitis: immediate surgery to remove appendix, IV antibiotics, semi-Fowler's position, MPO to rest gut. What is the general treatment for acute abdominal pain? MPO status, no heat on abdomen. Assess abdominal distension, IV fluid therapy. ABG, arterial blood gas. Where are most samples drawn from? Radial artery and wrist. How long should pressure be applied to the site after collecting a sample? 5 minutes. Which test should be performed before collecting ABG? Would be the Allen's test. That's what the ulnar. Asperger's syndrome, bottom of page 7. This syndrome is a form of autism. Focusing treatment would be communication, patient social skills. Moving on to page 8. Asthma, an obstructive airway disease caused by spasms and inflammation of the bronchioles. Signs of asthma are shortness of breath, tachycardia, expiratory wheezes, and possibly a cough. When will the client experience the cough? At night? The primary treatment goal is to identify the allergen. Medications work best: anti-inflammatory, corticosteroids, bronchodilators, leukotriene modifiers, metered dose inhalers, and a bronchodilator. First, you would always do the bronchodilator, then the steroid to open up the lungs with the asthma inhalers. Leukotriene modifiers are drugs used to block the chemical leukotriene, which reduces inflammation. Steps to use metered dose inhaler: shake the inhaler well before use, 3 or 4 shakes. Remove the cap, breathe out away from your inhaler. Bring the inhaler to your mouth, place it in your mouth between your teeth, and close your mouth around it. Start to breathe in slowly. Press the top of the inhaler once and keep breathing in slowly until you have taken a full breath, 3 to 5 seconds. Remove the inhaler from your mouth and hold your breath for about 10 seconds, then breathe out. If patients cannot tolerate a bitter taste or are experiencing side effects, they may use a spacer. Rinse mouth after each dose to prevent thrush. Client should wait only 1 minute between each puff. Moving on to page 9 with autonomic dysreflexia. Autonomic dysreflexia occurs in clients with what kind of injury? A spinal cord injury, T5 or above. The cause is noxious stimuli such as a full bladder or fecal impaction. It's serious because it is life-threatening due to clients becoming extremely hypertensive, high blood pressure. Big indicator for autonomic dysreflexia. What are the signs? Increasing BP, 40 mmHg, headache, bradycardia, blurred vision, sweating. What do? You place the client in high fallers first, check for bladder distension, and loosen restrictive clothing. Treatment is to remove the stimuli. Patient needs to void and have a bowel movement. Bottom of 9, Bell's palsy. Bell's palsy affects which cranial nerve? Cranial nerve number 7. The client with Bell's palsy suffers from temporary facial paralysis that affects chewing, eating, and closing the eyes. Treatment for Bell's palsy is to wear an eye patch at night, use artificial tears, wear glasses to protect the eye, and steroids to reduce edema and swelling. Page 10, BPH, benign prostatic hyperplasia. BPH is caused by the cause is unknown, but is an enlargement of the prostate gland. Because the prostate blocks the urethra opening, clients will feel and see what they urinate. Well, they'll have straining to urinate, decreased urine stream, feeling like they have to go all the time, dribbling urine flow. Who gets BPH and what's the best way to assess? Men over 50, rectal exam, physician will feel a pea-sized nodule. Common surgical treatment, transurethral resection of the prostate, TURP. TURP is performed with a scope that goes through the penis and removes part of the prostate. After the procedure, the client is at risk for bleeding, monitor for hemorrhage. All clients will get a 3-way lumen Foley catheter before a TURP. The 3 lumens are inflating the balloon, inflow of solution, and outflow of urine. What will the doctor order to be done after TURP? You want continuous bladder irrigation, CBI. The goal of bladder irrigation is to prevent blood clot formation. An incision will not be made. No irrigation will be done using the indwelling catheter. What? Page 11, quick facts. What type of fluid is used to irrigate the bladder? Isotonic, sterile, saline. You want the color of the urine to be light pink. During CBI, continuous bladder irrigation. Monitor the client for bladder distension, fluid overload, hyponatremia, which is low sodium, and blood loss. If bladder spasms occur, give belladonna or opium suppositories or ditropan. The best position for this client post-op, lying flat because sitting up puts pressure on the bladder with TURP. List some discharge instructions. Drink 2 to 3 liters of fluids daily, no lifting or straining. If bright red clots are present, call MD. Do Kegel exercises to strengthen pelvic muscles. Blood administration. What must be received before a transfusion is started? Signed written consent. Blood type considered universal is type O negative. What blood type is considered the universal recipient? Type AB positive. This completes page 11. We'll start page 12 next.